this is Dr. Sushma. So I'm a professor in medical biochemistry at NIMS University, Jaipur, India. So the topic for presentation is trace elements, electrolytes, minerals, and premenstrual syndrome among medical students, the missing piece of the puzzle. So coming to the introduction part, the pre-MS, the premenstrual syndrome is a complex interplay of physical, emotional, behavioral symptoms that affect significant number of women of reproductive age. The prevalence ranges from 20 to 90%. For example, in Iran, it is 98%, Egypt 80%, Palestine it is 71, followed by India it is 43%, and in US it is 20 to 30%, etc. The etiology of premenstrual syndrome remains undetermined. The research suggests that the imbalances in essential electrolytes, minerals, and antioxidants may be play an important role in the development and the severity of the premenstrual syndrome symptoms. By exploring the intricate relationship between electrolyte, mineral, antioxidant imbalances, and PMS symptoms, we can uncover potential therapeutic targets and develop effective strategies to mitigate the impact of PMS on the lives of the future healers. The present objectives of this study were to estimate and compare the serum levels of sodium, potassium, calcium, magnesium, iron, vitamin C, and uric acid among medical students with and without premenstrual symptoms. To compare the serum levels of calcium, magnesium, iron levels during premenstrual and the postmenstrual phases in PMS subjects. To find out the correlation between the sodium, potassium, uric acid, and vitamin C. The material methods include it is a cross-sectional study which was conducted in the Department of Biochemistry in association with the Department of OBG. For the current study, medical students from the phase 1, the first year MBBS to internship were selected, and they were divided into two groups. Those with the symptoms of PMS were labeled as case group, and those without PMS were labeled as control group. They were all in the age group of 18 to 30 years, and they have a regular menstrual cycles for the past 6 months. Only such kind of subjects were included in the study after obtaining the voluntary informed consent. The study was conducted in the Department of Biochemistry after approval from the Institutional Ethical Committee. Then how do we diagnose a patient with the premenstrual syndrome? So we label somebody is suffering from PMS looking at the 5 symptoms out of the list. So if they have marked affective lability, that is feeling suddenly sad or tearful, marked irritability or anger, marked tension or anxiety, decreased interest in the usual activities, subjective sense of difficulty in concentrating, lethargy or easy fatigability, marked changes in appetite or sleep, physical symptoms such as breast tenderness, headache, joint or muscle pain. So out of this, any 5, if the symptoms are present, they are labeled as premenstrual syndrome patients. The sample size, we included a total of 244 subjects with and without PMS in each group comprising of 122 subjects. The inclusion criteria is that the female medical student aged between 18 to 30 willing to give informed consent, having regular menstrual cycles of 27 to 33 days for the past 6 months were included. Subject with psychiatric disorders, ovarian dysfunction, gynecological disorders, pregnancy, postpartum period, patients using oral contraceptives within the last 3 months, serious physical illness, and patient taking any medication such as hormones were excluded from the study. The data collection, all the participants included in the study were subjected to general physical examination and anthropometric measurements. The body mass index was calculated based on the formula, which is obtained by dividing the weight in kilogram by square of the height in meter square. For sample collection, biochemical investigation, the 5 ml of fasting venous sample was collected under aseptic precautions was used for the estimation of sodium, potassium, calcium, magnesium, iron, uric acid, vitamin C in a fully automated integrated system called Vitris 5600. The statistical analysis was done using SPSS 22 software version, and the student test was t-test was used for the comparison between the two groups, and the Pearson's correlation coefficient was used for the correlation purpose. Looking at the results, this is a table one, which it is about the descriptive statistics of the control and the premenstrual syndrome group. We can look at there's a comparison of variables which include age, systolic blood pressure, diastolic blood body mass index. We could find the only significant difference with respect to age, but we did not find any significant difference across the groups with respect to the other parameters involved in this particular table. So the patient with PMS are much younger compared to the control group. Then we have this figure, which is going to tell us about the distribution of the premenstrual syndrome subjects based on the physical symptoms. We can see that most of the patients have abdominal pain. That is 100% of the patients were having abdominal pain, and followed by the backache and change in appetite, breast sensitivity, then abdominal bloating. Finally, in this is the first study to explore the family history in PMS patients. So we found about approximately 18% of the patients providing us the family history of premenstrual syndrome. This is a pie chart which is showing the distribution of the psychological symptoms. We can see that majority of the patients were having irritability during the premenstrual phase of the premenstrual syndrome, and 21% had anxiety, and 28% of them were having depression. So this is a table which compares calcium, magnesium, iron, uric acid, vitamin C between the control and the premenstrual group. So when we look at the comparison about the two particular groups, we can see that the sodium levels are increasingly higher in control compared to the PMS. There's a decreased sodium levels in the PMS group, and there's an increased potassium levels, and there is decrease in the iron levels, and decreased uric acid and decreased vitamin C levels in the patients with premenstrual syndrome as compared to the control group. With respect to the calcium and magnesium, we did not encounter any such significant differences between the two groups. Then this is the diagram which again shows the comparison of calcium, magnesium, iron during the premenstrual phase and the postmenstrual phase in the PMS subjects. We can see with respect to the calcium levels were much higher in the postmenstrual stage compared to the premenstrual stage. Similarly, we obtained a significant differences across iron levels, which were higher in the postmenstrual phase as compared to the premenstrual phase. What about magnesium? Magnesium did not show any such significance between the two phases in a PMS subjects. Then this is a table which is going to tell us about the correlation of sodium with potassium, uric acid, and vitamin C levels. So we can see that the significant correlation was obtained only for the potassium levels, but uric acid and vitamin C did not show any such significance with respect to the sodium level. That means as the sodium levels were increasing, the potassium levels were lowered in these subjects. Coming to the discussion part, in the present study, the pattern of the physical symptoms in the subjects revealed that majority of the subjects have experienced abdominal pain, backache, changed appetite, breast sensitivity, then bloating, irritability during premenstrual phase. The psychological symptoms which were evaluated in the present study shows that the major psychological problem that was encountered during the premenstrual phase was irritability, followed by depression and anxiety, which was in accordance with some other studies which were conducted in the other countries. All the symptoms related to PMS are mainly due to hormonal imbalance, especially there's an increased ratio of estrogen to progesterone. But there's an increase in the estrogen levels and the decreased progesterone levels, which is accounting for the various symptoms that we come across in a patient with PMS. It is also seen that 18 to 19% of the patients had a family history, which was the first study to evaluate the family history. Student t-test significantly revealed that there's a decreased sodium, iron, and the antioxidants like uric acid and vitamin C, and elevated potassium in PMS as compared to the control group. But such differences were not obtained for the other two parameters, that is calcium and magnesium. The adrenal hormones aldosterone cortisol are slightly elevated in PMS. In the luteal phase, there's an increase in the concentration of antithyroid hormone and the progesterone, the antagonistic effect in the aldosterone system. Hence, resulting in decrease in the sodium and encountering for the causation of edema. And there is a direct relationship between the decrease in the sodium and slight increase of potassium with the symptoms of PMS, especially edema, anxiety, irritability, confusion, and mood swings, as we found in other studies. Several studies also conclude that there's increased oxidative stress, which is manifested by the increase in the parameters of oxidants and decreased antioxidants, which is one of the main etiology accounting for the development of PMS, especially highly decreased parameters of antioxidants such as vitamin C, vitamin E, uric acid, glutathione, superoxide dismutase, etc. And there's a high increased levels of malondihyde are noted in PMS. This is mainly due to production of the free radicals, and there's a disbalance in the oxidative stress and the antioxidant balance, which is accounting for majority of the symptoms that is encountered in PMS. The imbalance in the hormone level, especially increased estrogen, decreased progesterone, triggers the oxidative stress. In this present study, we also found significantly reduced antioxidants such as uric acid and vitamin C. The study, which was conducted by Raja et al., in their study, they found a mild increase in sodium and decrease in the potassium, but in PMS as compared to the non-PMS, this was not statistically, it was not significant. And they found significant decrease in the calcium in PMS subject as compared to but the findings were not significant. A study conducted by Tia Verma, they showed there is no significant difference in the sodium potassium between the asymptomatic and the symptomatic group. Maybe because in this study the sample size were very less. It was only about 12 PMS patient and 10 healthy controls. So that is why the results are different in our study compared to the other study. Coming to the strength of our present study, we included pretty large sample size as compared to the studies conducted by the previous researchers. And we also taken into account of the family history, and we also evaluated calcium, magnesium, iron during pre and post menstrual phases in PMS subjects. To conclude, the findings suggest that the medical students experiencing PMS symptoms may benefit from personalized nutrition counseling, stress management techniques, targeted supplementation to elevate the symptoms and improve the quality of life. By acknowledging the interplay between the nutrition, stress, PMS symptoms, medical students can take proactive steps to mitigate the effects of PMS and optimize their overall health, ultimately leading to the better outcomes and better healthcare workforce. So, by this, I thank you for giving me a wonderful opportunity on this platform for my paper presentation. Uh, yeah, thank you.